Bilis mo na, friends.
Ano na?
Hindi ko magkaka. Iwan mo.
Sige, sige. Okay, mga anak.
Nasaan mo si Ryan? Tawagin mo nga.
Sino ko ulit?
Pati mo nga isaan mo ng Spotify ko dun sa may laptop. Nasaan ba si Ryan? Patay mo muna. Nasaan? Patay mo yan.
Saan yan? Sa radyo yan.
Anong radyo? Kailangan ko nga yan kasi nandun may audio doon. Ben Ray.
Ano na mga setup lang eh.
And this is for the live streaming, but just put this in the live stream. Yes. Siguro dito na lang to.
Mic din ba yan? Dapat sa labas.
Okay na, condenser naman siya.
Okay. Right, let's... Hello. Okay, I think this is better. So, as the title says, should we be concerned? Yes, I think we should. What is Boas? It's a syndrome, meaning there's a constellation or a series of symptoms that you have to watch out for. That's what syndrome means. Affected dogs exhibit a wide range of clinical signs, including snoring, exercise intolerance, and life-threatening events such as syncope or nahimatay, and heat stroke because of their condition. Now, we have brachycephalic breeds. So, this is actually a comfort-related respiratory disorder because it affects mainly brachycephalic breeds. There are certain other low-nose breeds that have occasional cases of Boas. It is more widespread in our breeds like pugs, French bulldogs, and bulldogs, among others. Here are the 3 most affected breeds, and that's why I'm here, because we're doing the French Bulldog specialties and all breed shows. And also pugs and English Bulldogs. Now, back to that please. Other breeds may also be affected because there are also snub-nosed like Boston Terriers, Japanese Chins, Pekingese, Shih Tzus, and Boxers. Okay, what do I mean by a brachycephalic obstructive syndrome? Let's hear what this is like. Sorry, that's not part of my presentation.
Suffer from brachycephalic obstructive airway syndrome, or BOAS for short. But with treatment, their quality of life can improve dramatically. The word brachycephalic is used to describe animals with abnormally short noses. We see this in dogs like French and English bulldogs, pugs, and shih tzus, and in cats like Persian and Himalayan. Abnormally short noses mean flatter, squash-looking faces. Because of this, brachycephalic animals are more likely to experience problems with their breathing. Sometimes these problems can become so severe they need urgent veterinary attention. Brachycephalic obstructive airway syndrome, often referred to as BOAS, is common in flat-faced animals. It refers to a group of conditions which are caused by a compacted skeleton and excess soft tissue. These conditions include a long and thick and soft palate, that's the fleshy bit at the back of the mouth. Narrow nostrils, which cause stenotic nails. Inverted laryngeal sacculus, which is when the air sacs at the back of the mouth are pulled into the windpipe. And a tongue which is too big for their mouth. All of these conditions obstruct the airflow, making it harder for the animal to breathe. Animals suffering with BOAS may experience one or a number of these clinical signs: snorting, snoring, and grunting noises, reluctance to exercise, clear nasal discharge, restlessness during the night, retching, vomiting, and regurgitation, and collapsing. These signs are made worse in the hot weather and if an animal is overweight or overexercised. Animals with BOAS can have a poor quality of life as a result of these clinical signs. Their condition can fluctuate and sadly lead to death in some cases. It is therefore recommended that BOAS is treated as early as reasonably possible. To diagnose BOAS, our specialist soft tissue veterinary surgeons first perform a physical examination. The next step is to inspect the patient's airway under general anesthesia, assess the severity of the obstruction, and decide what treatment is required. X-rays of the chest are also usually taken, as animals with BOAS are susceptible to developing other conditions like pneumonia. For most pets, surgery is a recommended treatment. To minimize the risk to the patient, it is preferable to perform the airway inspection and surgery during the same anesthetic. Surgery involves shortening the soft palate to the back of the mouth to remove the obstruction from the airway, widening the nostrils to enable your pet to take in more air with each breath, and sometimes trimming the laryngeal sacculus to further reduce the obstruction. Following surgery, your pet will need to rest at home for 7 to 10 days to allow the swelling to go down. Short walks for toileting purposes only are advised during this recovery period. The stitches used in surgery dissolve by themselves. Nonetheless, it is recommended that you visit your vet for a checkup 7 to 10 days after the surgery.
Okay.
Following this checkup, and further 20 guidance given by your pet will be able to resume their usual activities whilst being able to breathe more freely. It's important to use a harness when walking your dog, and always avoid exercise during the hot periods of the day. Whilst some have also undergone surgery for boa snakes still remain snoring or grunting noises, their quality of life would be greatly improved. If you have any questions about your dog or cat, please talk to your vet.
All right, that's what Boas is actually. And the thing is, if you have a dog with Boas, especially a severe case of Boas, they should not be bred because they will impart the same symptoms to their offspring. That's why we're here. So, why is understanding Boas important? Because, as you know, the animal rights movement, even here in the Philippines, has seized upon this topic, this concept of Boas as a means of destroying the dog fancy. And that's why we need to make sure that we are not perceived as being, perpetuating conditions that inflict torture upon animals or dogs. Next. So anyway, as a result of this animal rights movement, our Boas or Boas-prone dogs, like French bulldogs, have been banned in several European countries. And this may escalate to other breeds, and that's what we don't want to do and have happen. And the FCI Dog Welfare and Health Committee in 2021, and and we initially on Zoom and formulated our guidelines and what to do for this purpose. So in 2022, we had our first International Congress on Dog Health and Welfare in Mexico City. Next. Mexico Kennel Club, very progressive. They have their own semen ban. Okay. Next. They even have their own College of Veterinary Medicine. Impressive. It's well equipped. Next. They have a lot of space for offices, parking, and they have their own dog show site. Very big area, but open area. And here are some of the impressive things that you'll see in this compound. We have paintings, sculpture, and of course, as I said, lots of parking and lots of open. Next. So during this conference, a lot of our members, we actually all spoke during this on different topics. And this is Wenke Scaldi, now our president of the next. And we have represented animal rights movement, not animal rights, but animal welfare movement. And I also spoke on reading conservation. So I guess you can recognize our members here. Next. And the entire General Committee of Commission of FCI was there. So after that, there was a congress, or rather a conference on Boas held in Norway the following year. And I was also sent to attend this congress. The main proponent of this conference was Dr. Jane Ludlow, seen here, who is a well-recognized veterinarian in the UK. And she devised what we are using today as a means of evaluating dogs for Boas. Next. So we had lectures, and that's also, again, Jane Ludlow in the middle. Next. And we had, on the second day, a practical approach to diagnosing boas. And I was also fortunate enough that they allowed me to attend this purely for veterinarians, because they knew I was a medical doctor, and so as a representative as well of Asia Pacific. Next. So after that seminar, I was given this diploma. And although I can do the examination, I don't know if I can vet, okay? I'm just saying go through the training so that I can speak on it. So what can we do? Okay, first understand what boas affects us. And then we have to assess our breeding stock to breed away from the worst examples. So, constant. It's not just one instance, but we have to do it generation after generation to make sure we are not waiting it. So, now let's go to the identification of boas. Now, usually, as that video showed, it requires physical examination, next, and diagnostics, even CT scans, which actually we don't have here. Now, the best option really is what Dr. Jane Ludlow had devised, which is the respiratory functional grading scheme, or called RFG. So identification of boas will have to be a clinical assessment, which is a pre and post exercise thing. And somebody keep that dog from barking. Okay, so there are several grades of boas. Grade 0 and 1 are clinically unaffected. Grade 1 is very mild. Next, grade 2 and 3 are clinically boas affected. So you can actually steer them. Next. So this is again Dr. Jane Ludlow of the Cambridge University Department of Veterinary. And as we go along, we will know about the signs and symptoms of boas. Next is respiratory. I'm sure you hear some of our dogs doing that. Okay, that's stridor and estertor. So we also have, if you take note of the nostrils of your dogs, they should be slit-like. That's called cyanosis. And then you have gastrointestinal signs, right? They're regurgitating their food, lalabas yung pagkakain, they're having reflux, they're having difficulty of swallowing food. Next. And of course, when they sleep, they have snoring. Parang tao din yan, they snore. Okay? And of course, if you have difficulty breathing, you will have heat intolerance, because your efforts in increasing your oxygen level makes your metabolism higher. So you're actually generating heat internally, and then you go for more heat, and that will lead to heat stroke. Okay. And some of our dogs, I'm sure we have several instances here, they collapse and some may die. Next. Okay, just to make sure we understand what a normal breathing is and what abnormal is, we have videos to exemplify those. All the way, all the way. Next. Okay. Okay, that's actually normal panting. Okay, even humans, when they get tired, they pant. Okay. Now, this is what we mean by stridor. It's a high-pitched noise. Next. Do you hear that in your dogs? Watch out. Next. Stertor is a low-pitched sound, but still also seen in boas. Next. All right. So that's stridor and stertor. Stridor is the higher pitch. Stertor is the lower sound. Okay, next please. And then we also have what we nasal stenosis. And these are different degrees of the stenosis for different breeds, okay? The first one on the left of the screen is pugs. Okay, you notice up there is the normal wide open nostrils, okay? And then you have slightly less open in the second. And then now you have a narrowing of the airway here. And the last is everything is narrow, slit-like. So that's really hard to breathe. And in French Bulldogs it's the same, but we have different conformations of the nostrils in different dogs. But just the same, you can see the progression of the stenosis. Okay? Next. Body condition. A dog that is very fat will also get aggravated by boas. The fatter your dog is with boas, the more difficult it is for that dog to breathe. So here is a body condition score in pugs. And you see that if you look at the dog from the top, okay, like so, this is obviously a very obese dog and several degrees of obesity until which is BCS6 is actually should be the ideal. So not too fat, not too thin. Next. And so Dr. Jane Ludlow came up with a respiratory functional grading scheme, or RFG scheme. And with that scheme, there are 4 grades. Grade 0 is boas free. But if your dog is under 2 years of age, you don't know if it will develop boas later on. So until it reaches 2 years of age, you are not certain. You need to have a checkup occasionally. Okay. So let's see what the boas grade 0 is. Post-exercise test. No. Nagsamang address. Anyway, here it goes. So they were filmed during resting stage and then after the 3-minute exercise. The 3 minutes is when you put a stethoscope to the neck to hear the sound. there is none of the stridor or stertor, di ba? Normal lang ang nakikinig natin. Okay, so that's grade 0. That's normal. Next, we go to functional grading assessment, grade 1. Okay, what is this? These dogs are clinically unaffected, meaning they don't show symptoms normally. Next. But annual checkup is recommended if the dog is under 3 years old. So as the dog ages, it gains more weight, and some conditions appear. Your muscles, your respiratory muscles may be weaker. Next. And let's hear about grade 1. Same thing, it's a standard 3-minute exercise test. Increase the sound. All the way up. All the way up. Lahat. Taas. Na marinig. Taas mo lahat. Again, that's using a stethoscope. So you hear some stridor, some high-pitched sounds, but it's not that bad. I mean, it's just occasional. Okay. Next. Okay, now we go to grade 2. This is definitely affected dog with grade 2 Boas. So you will see moderate respiratory signs, and the dog has clinically relevant disease that needs veterinary attention or weight loss. Then we'll hear about grade 2 and how it sounds. I actually did a sample demonstration of this. That's my auscultation. Here. A circle. Okay, well that's grade 2. Grade 3 is very, very obvious because you don't need any exercise. When you examine the dog, you will actually know that is a grade 3. So grade 3, you will have to have thorough vet examination and intervention. Next, let's hear it.
These children's breeds are very common, making many owners very happy. The way the neighbours and parents struggle to breed might seem funny to many people, but it's not funny at all. These are done.
Resting. You don't even need a step. Grade 3. Milder. So yeah, that's Strider. With grade 3, sometimes you don't even need to exercise the dog. You will hear it at rest. With plain hearing, no need for a stethoscope. Those should not be exercised. For grade 3, no exercise, you hear it at rest. Yeah. Don't over-exercise them. The first thing to do is get them evaluated by a vet and make sure they lose weight if they're obese. But the vet will have the last say as to what to do. Baka kailangan niya ng surgery. Okay. So, okay, next please. So, like I said, you should not exercise any dog with obvious grade 3. Okay. Now, for exercise, you're supposed to, this is under ambient conditions, meaning yung temperature is normal for other countries. But here, I will not advise exercising them outdoors. It should be in an air-conditioned venue like this, where the temperature is at least 24 degrees or 23 degrees. But just to be fair, because they're not really comparable if you exercise them outdoors here in the tropics versus in the temperate countries. So you trot them, meaning it's a fast-paced trot. 3 to 5 miles per hour, maybe 10 kilometers an hour for 3 minutes. Can do a fast walk na lang. Now, post-exercise examination, immediately after the exercise, they should be auscultated. I use a stethoscope for that purpose. And the dogs must be over 12 months of age to be valid for this particular scheme, for the evaluation. But if you have dogs that are undergoing collapse or syncope, is actually nahimatay. And cyanosis means the tongue goes blue. So that means there's a lack of oxygen already. Don't exercise it. That's automatically grade 3. No need for an exercise. No need for stethoscope. Next. So this is what the Cambridge University College of Veterinary Medicine devised. and it's now in use in the UK for evaluating dogs. So if your dogs are grade 3, you cannot enter your dogs in any shop in the UK. Okay. Next. And this is the assessment form. There are different assessment forms for bulldogs, for French bulldogs, and for pugs. Only 3 breeds have been assessed, or rather evaluated for this particular scheme. The others are going to follow. So we only have data for these 3 breeds. Next. So this is how you grade them, and I explained that during the video. So you make sure you don't see cyanosis or blue tongue or syncope if they collapse. That's automatically grade 3. Okay. Next. Anyway, so after this, after the knowing what Boas is, what can we do? Okay. Next. Okay, what is the practical application of the RFG scheme to breeding programs? If you have your dogs evaluated by RFG, and they are graded from 0 to 3, grade 0 is clear. They're good to breed. Of course, that's only regarding Boas. You need to see the standard in the dog as well. Next. Grade 1 can be bred, okay, but only with grade 0, so you don't aggravate the problem. You want to produce puppies that will not be grade 1 or even worse. Boas grade 2, if this is a very valuable specimen of the breed, like it's a very nice dog or bitch, and it deserves to be perpetuated, you should do so with caution and only breed with grade 0 specimens. And of course, you evaluate the puppies. If they come out good, like 0 or 1, at least that's an improvement over that grade. Grade 3, please don't breed them at all. They may not even survive, the bitches may not survive. Okay? So, how about RFGS implementation? Okay, so as I said, the Kennel Club of the UK is already implementing it, and so are several other countries in Europe. Canada is starting. USA, I've been hearing about them using the RFGS, but in Asia or other areas, we have not even made the first step. I think the first step is to make sure that people are aware that there is such a thing as Boas. So that's why I'm talking here. Next. Anyway, the Cambridge University has a, what do you call this? I don't know what, is it a patent or whatever, but they have the rights to this RFGS. In order to use it, you must ask them for permission. And the permission means that you have to have at least one veterinarian trained that will oversee the implementation of the scheme in that country. So I don't know if we can do that for safety, or because that means that vet has to go to Cambridge to study. Okay, so hopefully you have learned about Boas for this session, and thank you for your attention.
Thank you, Dr. Lo, for allowing us to learn so much from you, and for any updates, you just keep in touch with the club. And our club would like to give you a gift of gratitude. Thank you so much.
personalized pa. Wow.
Thank you, Dr. Lo.
Thank you.
Such a privilege and honor to have you in our club.
Thank you. Thank you. Oh. Wow, parang scepter.
Thank you
you.
so much. And we will start now pre-match talks by Sonia Davis from London. If you have a video and you can click your video over, I think, over there. Yeah. So please prepare your notes. Thank you so much.
You can ask me questions personally.
Thank you, thank you. Yung kahit hindi siya naka-ano, sa bilingal, hindi ko sa
It can be any part of the respiratory tract, like nostrils, very narrow, or the trachea, or sometimes there's tracheal stenosis, yung trachea mo very narrow. So there's a lot of factors here.
kasi syempre pag tumingin tayo ng aso, di ba? Sometimes pictures or something.
Yeah, you need to see that dog as a person.
Thank you, Doc. Tita.
Meron ba tayo tutuloy sa judge? Hindi na
Hindi ko makita sa net eh. Kanina yung dalawa nakita ko yun sa internet eh.
I'm sure I had a dog na ito.
Sorry. Yung live.